So you want to increase claims payment. Are you sure? My brutally honest advice to hospitals, doctors, top management, board members, and CFO. Know the difference between trained medical evaluator versus an untrained medical evaluator. The medical evaluator po is a doctor who will pre-screen the claim before transmitting to PhilHealth. So, pre-screen is the word. Question: how do you know, okay, if the pre-screening is correct? Okay, there is a proper way on how to do it. There is a professional way on how to do it. Okay, if your hospital medical evaluator, okay, you ask them, tama po ba ang pre-screening nila? Okay, may training po ba sila? If your hospital has no medical evaluator, okay, that is a different story. Malaki ho ang problema ng hospital ninyo. So, what is the difference between a trained and you have here an untrained medical evaluator? So, let's do this one by one. Okay, first, the basis of pre-screening. So, untrained medical evaluator will pre-screen the claims by doing a clinical review. That's it. End. Period. So, a trained medical evaluator will screen based on compensability rules of PhilHealth plus the clinical review. PhilHealth compensability rules are the priority. So, they will screen the chart and they will screen the claim. So, pre-screening is based on PhilHealth standards, there is policies, and there are rules. So, there is a clear basis. It is anchored in PhilHealth standards. Now, number 2, trial and error. So, an untrained medical evaluator will do a trial and error review. So, it will be based on stored knowledge and some clinical background. Usually, yan ho. Now, unlike ho itong trained medical evaluator, review is always based on a checklist. The checklist po is also based on PhilHealth standards. There is a clear direction. There is pinpoint target. Ito there are specific items they will look for. They will look for distinct terms. They will review, okay, presence of very precise conditions. Yun ang importante. Let's go to number 3. What to review? Untrained medical evaluators will review all, okay, claims given to them. They will actually drown themselves by reading the documents that PhilHealth will not even care to read. It ends up very stressful for them. Now, trained medical evaluators will read priority illnesses and priority procedures. There is a list of illnesses and a list of procedures that they need to focus on. Now, there is a reason for this. This is intentional. This is what I tell them. So at the end of the day, this is less stressful. Okay, number 4, credibility. Doctors or clinicians will always doubt untrained medical evaluators. So many doctors will not listen to their suggestions or interventions because there's no credibility or experience to start with. Kasi for the doctor's perspective, okay, they will always look for evidence-based data. In short, okay, wala pong evidence na tama po ang medical evaluation ng isang untrained medical evaluator. Okay? Many of them will look timid. Okay? the face is doubtful, unsure, and there is less confidence. So the doctors will not follow their instructions. Now, unlike the trained medical evaluator, so after I train them, after being marinated with inputs, eto po they will use the same terminology, same words, jargon, and phrases that I actually use. Aside from teaching, okay, and aside from the experience that I will give them, they will actually sound like me. They are calm, confident, and a little assertive, plus probably a little arrogant. Okay? Now, they will gain respect and the confidence of the doctors. Okay, ito number 5, collaboration. Ito medical evaluators must collaborate with the entire medical active staff. Ito. The untrained medical evaluator will have a hard time collaborating with the entire active medical staff. So kasi you cannot collaborate if you are half-baked or hilaw. So, if the medical evaluator po is hilaw, you cannot discuss PhilHealth standards or policies with confidence. It's going to be very difficult, okay, to relate one specific circular and associate it with the other circular. As a result, the active medical staff will see you as ineffective. Now, unlike a trained medical evaluator, collaboration with the active medical staff is less problematic. Now, since there is less issues in integrity, less issues in experience, PhilHealth circulars, standards, policies are easier to convey to active medical staff. So, my friends, if you want to increase yung claims payment ninyo, invest in a trained medical evaluator. The trained medical evaluator po will give PhilHealth what they want to see. So, your small investment will create millions for your hospital. So, question, how do I know this is effective? Alam niyo po, I've seen it in so many of my hospital clients. Okay? So, stop wasting money. Be one step ahead. Get a trained medical evaluator. This is Coach Doc Ben. See you soon.